remember being wheeled in. It's pretty surreal though when you're being moved in by a bunch of people and you see all the lights and everything, and then
just focus on big, slow, deep breaths as you drift off to sleep.
I wanted to fight it falling asleep so I could see what that feels like, being floating for a little bit, but it was pretty much, I don't even remember falling asleep. I think they just hit me and I was just boom, lights out.
I'm just gonna come in, do what I usually do, and we'll be done.
Doc said, so it was kind of a gamble for me going in there. It could have either been a quick recovery, which would be like a month to 6 weeks, or it could have been like a 6-month recovery, depending on what they went in there and found. I'm stoked. I woke up in here again and all good news. I'm psyched. It's not gonna be a long recovery.
So you just have 2 small incisions.
Okay.
Okay, just on either side of the patellar tendon. So here the meniscus is actually, normally it should be attached to the bone here, but it isn't.
It's got a little gap, huh?
There's a gap. Since you didn't want me to repair it, I didn't. I just trimmed this. If I did stitch it back to the bone, that'll be a really long rehab process. The other thing, fixing that might actually limit your hyperflexion of your knee when you're surfing, and I didn't want to do that.
Oh, you think stitching it might have affected how deep I can get into hyper? Okay.
Exactly.
Good call.
So see with the shaver I just smoothed, and I took off maybe just a millimeter of cartilage right here so you don't have that loose flap lifting out. Okay,
Yeah.
So that was in the lateral compartment of the knee way at the back, and then coming back to the front of the knee, that cartilage defect, the cartilage in the groove on the end of the thigh bone in the front, I just trimmed it. Again, it did not go down to bone. I did not need to do microfracture.
Good man, good man.
What I did find right behind this meniscus, see, look at this. I put a probe in here, and this was actually a kind of firm, calcified body.
So that's what was getting stuck in there?
So I think when your knee is deep hyperflexion between the femur and the tibia, the joint capsule at the back was just getting irritated. Over months and years of irritation, that tissue thickened and it eventually calcified. So I removed that. So when you see here, see how much space there is?
Yeah. So it was just basically blocking up that joint.
Mechanical block, exactly. Yeah, it was because of mechanical block to your motion. So yeah, everything went well, and now it's progressive activities is tolerated, no restrictions, okay?
Okay.
We'll just work on getting your swelling down, increase your range of motion. After that, start working gradually on your strength. Once the incisions heal, 2-3 weeks, you're back in the water.
Wow, so not 6 months.
Not 6 months.
All right, I owe you a few waves.
Okay.
Thank
great.
you.
Yeah, you're welcome.
I hit the roulette table hard and got the short recovery. I didn't get the 6-monther, so I'm stoked. I'm pretty excited just to surf without having that little pain in the back of my mind, because it affects the way I read the wave and affects the timing. Because you connect surfing, you connect each turn to turn to turn to compile the wave. And when you're like 1 millisecond off from the beginning, it changes everything. That just, that opens up my whole summer, and I can have a lot more fun. Unleash it, let that thing rip. I'm excited. I can get out and be active and do everything that I feel like I was born to do now.